A developing story here on SportsCenter. The reigning WNBA MVP, Elena Delle Donne, tells ESPN that her opt-out request was denied by an independent panel of doctors, deeming her not high risk for COVID-19, even though she's been treated for Lyme disease for years. This ruling means she's able to play in the WNBA's bubble and must decide whether to join her Mystics teammates in Florida. And with that, we are now so pleased to welcome in two-time WNBA MVP Elena Delle Donne. Elena, what was your reaction to the WNBA's decision?
Shock. I mean, for 9 years now, I've been dealing with Lyme disease and other co-infections that have destroyed my immune system, and I've been immune compromised for years. So when COVID has come around and I saw that if you're immunocompromised, you have to be super careful. I've been that, and I went through the process with the league of submitting all my information. My doctor, who's been treating me for 9 years, submitted a letter basically saying this isn't safe for her. So when I got the call that I was denied, I just was completely shocked. I didn't understand. And now it's almost like I'm asked to ignore the one doctor that heard me and has been treating me and is enabling me to kind of live a normal life with the protocol and the treatment he's had me on for years.
Elena, why do you think that there is a discrepancy then between your personal physician and the independent panel of doctors that it was assigned by the league?
Unfortunately, this is something I've gone through ever since contracting Lyme disease. There's so much that people don't know. There's so much information missing. And obviously, I haven't done enough to speak up about this disease. And clearly, there's still a way lack of information. And there's a lot of doctors that still refuse to believe that when you have Lyme and co-infections, it can be reoccurring and you can have infection for many years. So this is kind of an eye-opener once again for me that not much has changed in 9 years, and I've got to do my part and continue to speak up and speak out for those people that are fighting the same battle that I am.
Yeah, Elena, I mean, people see you, I think, as this sort of mythical figure, someone who dominates the game. How does Lyme disease affect you?
I mean, I take 64 pills a day, and throughout the day, I'm taking these. I know taking that much medication every day probably doesn't have a great effect on my long-term health, but I love the game of basketball. I found a protocol that sometimes works for me and enables me to play. But I think I'm just going to have to be way more open about my treatment, which I've been private about because, you know, medical things, you're not always open. But I think people deserve my honesty and deserve to see the fight that I go through to just have a normal life, let alone be on a basketball court.
Elena, you are the reigning MVP on the defending champion Mystics. How much of your prominence in the sport do you think weighed into the league's decision?
I'm not sure, and I really hope it didn't. I would hope they would treat me as player X, and they see that I've been treated for something for 9 years. They've seen my blood work. I submitted everything. So I really hope that wasn't the reason why this happened. I hope it's doctors just still being unaware of Lyme disease and not having Lyme literate doctors on that panel, because I don't want to believe that that's what happened, but unfortunately, it might be what happened.
As it stands, you cannot currently appeal the league's decision. So what is the best possible outcome for you in this?
It's going to take me a couple days just with my wife to decide, you know, what's next. Luckily, I'm privileged enough to be able to make a decision. And I know there's so many people right now through COVID who have lost jobs, who are going hungry, who don't have an option to make a choice whether to, you know, go to their job or not. So I'm in a position where, thank goodness, it's not going to be easy. It's never easy when you lose an entire salary, including endorsements if I'm not playing. But I'm in a position where we can figure it out. We'll find a way to push through if my decision is to not go play. So we'll see what happens, but we're going to have a few discussions. And maybe this is good. Maybe this is an awakening for me to speak up more about Lyme disease, to fight for the people that have been ignored for years, just like myself.
Elena, the start of the WNBA season is 10 days away. What's your timeline for making this difficult decision on whether to play or not?
I think it'll be pretty soon. This isn't a decision I want to drag on, and it's not something I want my teammates to have to worry about, my organization. I want this, us to move on from this, but it's going to take a couple days for us to figure it out.
Elena Delle Donne joining us here on SportsCenter. Thank you so much for joining us, and good luck with your decision.
Of course. Thank you.
Well, as for Delle Donne's Mystics teammate, Natasha Cloud, who is also sitting out this season, but doing so to continue to fight for social justice causes, tweeted, "It's BS. At WNBA, either play or risk her life. What do we stand for?" Because apparently it's not the players.